Nurses are part of the growing movement to hold the Ontario government accountable. You've heard from many others here today describing the government's plans to cut the public health services, to cut local ambulance services, and further this agenda of privatisation. We don't have to be professionals to know that these cuts are harmful for everyone, because critical services, we know, are about to be reduced even further than they are right now. The vital work of public health nurses is well known to all of the community. They improve people's health through teaching healthy eating habits and smoking cessation programs. When mums need support, sorry, I said mums, I should have said moms. It's not with a U, it's with an O, right? When they need support with their newborns and are learning to breastfeed, public health nurses are there to help. These public health nurses make our communities safer with sexual health counselling and testing, and provide the only place that some of the most vulnerable people living in Ontario can get access to primary care today. I can't stress enough that the work of public health nurses is vital, but unfortunately, like many healthcare services today, they are largely unseen. Unless you need these services, you don't know you need them. Most people don't see the infections and poor health outcomes that public health nurses see. Their work is upstream healthcare, preventing today. For the cost of $1, they are preventing illnesses that cost $100 to resolve years from now. Every one of our communities value this vital service, and Premier Ford has promised to end hallway healthcare. I think well, at least a large amount of people seem to believe that, unfortunately, but cuts to public health will do nothing but increase the burden on our already overstretched hospitals and healthcare services. And with less access to public health services in our communities, people will be sicker and forced to find care in hospital emergency departments. It's absolutely wonderful to hear the emergency physicians echoing that. And I can tell you right now that the Ontario Nurses Association's registered nurses, professional healthcare workers and others will not stand quietly while this happens. We are demanding an immediate stop to these cuts, not just a temporary reversal, but a permanent halt. There is no constituency that we can find that actually supports public health cuts. Ontarians overwhelmingly understand that these Conservative government cuts are harmful. They know that our vulnerable populations will suffer the most. And I'll tell you right now, we're just starting to learn what the Ford comment, the quote from Ford was, not one single person will lose their job. We're starting to learn what that actually means now. It has started, already begun. It means the layoff of 9 public health nurses from the Healthy Families and School programs at Windsor Essex Public Health Unit. They're cutting an entire program because of the 5% cut in provincial funding. These cuts will be felt, and we know as Ontario nurses that some cuts don't heal. That's why we're going to keep speaking out so the government can hear us. Nurses say no to public health cuts, no to cuts to local healthcare and ambulance services, and no to privatisation. We're going to keep the pressure on until the cuts to public health are stopped and rescinded. On behalf of myself and the entire Ontario Nurses Association, thank you very much for being here.
Thank you very much, Andy. Thank you.